Holly is a mental health nurse and founder of NHS Workers Say No. Holly's been a voice for the NHS and the nursing profession, and with Labour MPs or former Labour MPs, Jeremy Corbyn and Russell Lloyd-Moyd and others, marched to the Prime Minister's home in Downing Street to deliver a petition calling for a 15% pay rise for workers, for NHS workers. She's a familiar sight on picket lines and encourages all workers to join a union. So over to you, Holly.
Thank you very much. And what a testimony to follow from Matt. And when he spoke about how the NHS is delivering substandard care, I think all of us working in the NHS, we feel that. We feel that we're giving substandard care a lot of the time because we're forced into that situation, and it's painful and really demoralising for us all. But it is really great to be here with you all this evening. As Candy introduced me, I am a registered nurse. I've worked in the NHS for the past 15 years, and the past 12 of that has been in child and adolescent mental health services in CAMHS. Now, CAMHS, I think we all know, are in a bit of a crisis. We're underfunded, we're under-resourced, and we're facing, at the moment, one of our biggest issues is serious supply issues due to global medicine shortages. An average wait time for children in CAMHS is 2 years, which is an increase in 2/3 since 2022. And I work with very young children from age 5, so you can imagine how devastating a 2-year wait can be for some of those children with extremely complex needs. So thank you, KOMP, for putting on this important event, bringing us all together across trade union movement, campaigns and communities as well. To fight for this fully funded NHS. Everything we're discussing tonight affects us all, and the implications of lack of action, lack of change are very serious. And for me, this is a real issue of safety and standards. Throughout my career, I've experienced some real highs. I've also experienced horrific lows. Highs have generally been down to teamwork, as everyone in the NHS knows, wonderful colleagues, the broad range of people I meet from all corners of society and across the world. The lows I place firmly at the feet of consecutive governments who have consistently restrained our pay, left our hospital buildings to crumble, crippled student nurses with tens of thousands of pounds worth of debt, and ultimately have left our patients to die. And the insults to us all continue. The Health Secretary this week proposed league tables of trusts in an attempt to shame us, pit workers against each other. Why? To demoralise staff in areas of severe deprivation and reward better performing hospitals with more funding? How is that going to make anything better for any of us? What I've witnessed in recent years is outsourcing really pick up a pace. Last year, a big part of the CAM service I work for went out to tender, and the contract was won by HCRG, who were formerly known as Virgin. We've witnessed a very dangerous downgrading of services, with band 5 posts, which were always filled with registered staff, now filled with mental health workers with no professional qualifications. So where is the professional accountability and safety for our patients? The teams which have remained in the NHS, which is one of the ones I work for, are essentially the teams which now deal with the highest risk and the most complex patients. We're completely overwhelmed with devastating cases which are taking their toll on our team of 10. We've currently got 4 colleagues from my team of 10 off work with stress. Now, we know what's happening in my trust isn't an isolated case. We're sending billions of pounds to the private sector right now. We've known for a while when the private sector has patients who are too unwell or risky for them to care for, they send them back to the NHS, which is what we're dealing with at work. They take all the profit, they take none of the risk. And we've known this part for a while. And we've known that we waste billions when the care is just transferred back to the NHS. This is wasteful. It's taken its toll on the NHS workforce. It is so desperately demoralising. And it gets worse. We all know that when a private provider may mess up the care of a patient Wes Streeting sends them to magically bring down the waiting list, there's an agreement with these hospitals that the NHS remains ultimately responsible as the entity that commission that care. This is costing us millions. It doesn't make sense. So what do we want to see happen? We need investment in staff and services. We must raise pay, improve working conditions, and waive tuition fees. Burnout, low staffing and increasing patient needs are forcing staff to quit. More staff are leaving the nursing register year on year than are joining it. This is very dangerous. Recent figures show that since 2021, there's been a 43% rise in nurses quitting within 10 years. And let's not forget, there's only one pool of healthcare workers and professionals. When we increase demand on the private sector, staff will just move across from the NHS. Private providers don't train NHS staff. I didn't do a single one of my 2,800 placement hours during my nursing degree in a private hospital. Whilst the government talk about increasing training places without addressing the core reasons why we have a 40% drop in applications to study nursing and such a staggering amount of vacancies, we have no confidence in their plans. So to summarise, privatisation is bad for our health. The evidence is there, which is why we have to continue to mobilise. It's great to meet Matt here tonight from the SNF dispute. I send full solidarity to him and his Unison colleagues. The public support in Colchester has been incredible, and disputes such as this is where we all must continue to link the struggles. I want to work in an NHS that's safe for me, my colleagues and my patients. And for almost as long as I've worked in nursing, I don't really think we've had that. So please support staff on their pickets, especially, along with Matt and his Unison colleagues. There's ongoing disputes in Barnet and Manchester Health Services, and my nursing colleagues in Northern Ireland are currently being balloted to strike as their pay falls behind the rest of the nation's. Our fight is your fight, so let's all keep going.